the number of patients arriving to the hospital was continuously increasing. It was a nightmare. Every day we need a room, we need beds for ICU for patients with respiratory failure.
Over the past year, as COVID-19 spread across the globe, we have suffered tremendous loss from this virus. But we've also seen incredible efforts from those on the front lines to better treat patients and save lives. From around the world, there have been countless stories emerging of courage, sacrifice, compassion, and innovation. People and communities have risen to this moment together, right in front of our very eyes. These are some of their stories.
2 weeks ago, they put a call, out in terms of like, hey, are there any salary people who would be willing to come out to our MADISON facility and work in production so we can ramp up as quickly as possible. So when they did that, kind of was in a position, was able to help, and so volunteered.
We could probably get them out within the same day. If we get like a full order of 20 or so, we could probably get them picked and packed and ready for the truck within that same day.
How long have you been working at the plant for?
27 years.
That's a significant amount of time.
It is.
Have you seen anything quite like the demand and the way that production's been ramped up and the demand's been put on you and your teams?
No, this is the first time I've seen anything like this.
In 27 years?
27 years, yeah.
Once I said I would volunteer, I went home, I was laid off for a couple of weeks, and then I received a phone call asking me to report here.
Employees did not have to come back to work at the time. They're on layoff because of the COVID-19 crisis. So everybody you see here is volunteered to come in and help out and for the cause.
Since they have a woman with a very critical situation in the hospital, and unfortunately there is no ventilator available at that time. And we succeeded to prepare, deliver, and install the machine within the next 4 hours. Can imagine. And the hospital is not in Tunis. It was 2 hours away from Tunis capital. It was in Sousse, and it was a curfew situation where we cannot move everywhere. And we are happy because 2 days later we heard that the woman was able to go home and she survived.
Just imagine first. We do not have enough medical staff. That's a shortage for us at the beginning. But for the the Southern Garden Hospital, I have done the 1,500 chest CT scan already.
Those patients in the intensive care units, they are the most severe cases. Close to 10% require a CT every day. So we are actually now dealing with 180 intensive care unit beds. So the only answer was that, well, we have to have an additional CT. And that's not simple to have that in just 15 days, I can tell you.
We lost our professional identity because we abandoned our cardiology specialty at the very beginning to become intensivists or infectious doctors. So we have to learn a completely different job.
I don't think that I do really have an advice. I have a lot of respect, okay? And because I think that they did a lot of sacrifice in this period. There have been many women have come to see their babies without their partners. Many of them give birth without anyone beside them. And this is a huge sacrifice. So I think it's just a thank you and stay strong.
With CT, it takes only 3, 4, 5 seconds to know whether they have that COVID-19 pneumonia. The project is to use artificial intelligence to be able to predict these outcomes occurring after 1 week of symptoms.
So right now, the ECG is not used to diagnose COVID-19. But when someone comes in, you don't know what's causing their symptoms. Then we check an ECG to find out, number one, is this a primary heart problem or might it be COVID-19? And number two, if it is COVID-19, is the virus affecting their heart? Are they having heart problems with it?
We know we can immobilize, whether it's COVID-19, we're able to mobilize where our ICU patients are, where our COVID-19 patients are, where our ventilators are, where we need them. So going back to artificial intelligence as well, we can clinically try to drive ahead of time. We're trying to be proactive, not reactive.
I think we all have a brand new appreciation for people that work on the front line. And the risk people took, that's really, I think that's changed mindsets of a lot of people, actually. I just want to pay huge respect to the 50,000 people that work in GE Healthcare. Just to see an army march with the right attitude, the incredible passion, understanding of our purpose and our role in all of this has been really very heartening, actually. And it's amazing how people made sacrifices. We just have to be incredibly grateful for that. We'll never be able to repay some of it.